Experiencing heart problems while exercising can be concerning, and it's important to address it carefully. If your heart rate becomes too high during exercise, several things can happen, which vary based on the intensity of the exercise, your fitness level, and any underlying health conditions. Here's a breakdown of what occurs and potential risks. 1. Normal responses. When you exercise, your heart rate increases to meet the higher demand for oxygen and nutrients by your muscles. This is a normal physiological response. However, if your heart rate rises too much, it could indicate the following. Increased heart demand. Your heart is working harder to pump blood and oxygen to your muscles. Elevated breathing rate, to help with oxygen delivery and carbon dioxide removal. Increased body temperature. As your muscles work harder, they generate more heat, which your body needs to regulate. 2. Potential risks. Exercising at excessively high heart rates, particularly if you are unaccustomed to intense exercise or have certain health conditions, can lead to dehydration. High-intensity exercise increases sweating, which can lead to dehydration if fluid intake isn't adequate. Heat exhaustion. Prolonged high heart rates, especially in hot conditions, can contribute to heat exhaustion, characterized by dizziness, nausea, and excessive sweating. Overexertion. You may experience fatigue, shortness of breath, or lightheadedness. Overexertion can strain your heart and lead to injuries. Risk of heart problems. For individuals with underlying heart conditions, excessive heart rates can increase the risk of arrhythmias or more serious heart issues. Reduced performance. Exercising at a heart rate that's too high for extended periods can impair performance and lead to quicker exhaustion. 3. Symptoms to watch for. If your heart rate gets too high, you might experience palpitations, a feeling of rapid or irregular heartbeats. Dizziness or lightheadedness, due to reduced blood flow to the brain. Shortness of breath, difficulty breathing even when you're not at peak exertion. Chest pain, a more serious symptom that could indicate a cardiac issue. 4. Monitoring and management. To manage and avoid excessively high heart rates, know your target zone. Calculate your maximum heart rate roughly with the formula 220, your age. Your target exercise heart rate is usually 50 to 85% of this maximum, depending on your fitness goals. Use a heart rate monitor. Wearable devices can help you track your heart rate in real time. Gradual warm-up and cool-down. Properly warming up and cooling down helps your body adjust to changes in activity levels. Listen to your body. Pay attention to how you feel and stop exercising if you experience any concerning symptoms. 5. When to seek medical advice. If you consistently experience a high heart rate during exercise or have symptoms like chest pain or severe dizziness, consult a healthcare provider. They can assess whether there are underlying conditions that need to be addressed and provide guidance on safe exercise practices. In summary, while an increased heart rate during exercise is normal, excessively high levels can pose risks. Monitoring your heart rate, staying hydrated, and understanding your body's limits are key to safe and effective exercise. Thank you for watching. Don't forget to subscribe our channel. Don't forget